Hey, how you doing? My name is Christopher Gore. I am conducting a usability test on my healthcare app. And who am I speaking to?
Yusef Ransom.
Nice to meet you, Yusuf. Thank you for taking time to conduct this usability test. Tell me a little more about yourself, what you do, who you are, what you do for a living.
Yeah, currently I am a postdoctoral research fellow at the Harvard Chan School of Public Health. My background is in public health, so I have significant training on study design, methods, and just more analyzing the social epidemiology of several health-related outcomes. Specifically, I'm focusing on the social determinants of HIV diagnosis and infection within the United States. In particular, trying to understand why there are disparities in some neighborhoods with regards to the rates of infection,
Hmm.
and to understand what variables we may need to intervene on to eliminate those disparities.
Oh, it sounds really interesting. Sounds like some really interesting factors that need to be taken into account. So, because this is a healthcare app, this is actually along those lines of what you're working on, and it's there's some similarities. So that's very interesting. Um, and kudos to you, Harvard. That's very impressive. Um, what are your experiences with
I think
with
I
with
missed you
with
for a
apps?
bit.
What are your
Sorry, I
experiences?
missed you for a bit. Your screen had froze, so I missed a
Okay.
little chunk of what you said.
Yeah.
Yeah.
I was saying that's very impressive with what you're doing, and it goes along the lines of even with what I'm building, along the lines of healthcare, finding an urgent care
Mhm.
facility. So, what is your um experiences with apps? Like, how do you go about using apps for your everyday or non-everyday life?
Um, yeah, I'm trying to think of the apps. I mean, I mostly use sort of built-in apps in the phone like GPS, and every now and again things like Yelp, or Spotify, and
Right.
most recently OfferUp, and that's probably the most service-based or service-oriented type app I've used, and I use that to pretty much sell some furniture that I bought and no longer needed.
Okay. So you
So I would say
go ahead.
so I would say like day-to-day basis, not as much, but more per whenever I need specific tasks done. I try to find maybe an app that's useful for that, such as OfferUp, for instance.
Okay. Very good. Very good. So you basically use apps for leisure activity, music, and map GPS use, and just to get around for the most part.
Yeah, pretty much. Yeah, yeah.
Okay. So so like I was saying, the app I've created or helped
Mhm.
designed is to basically find specific um doctors and urgent care facilities within the area. So if you can open up the app right now,
Okay.
I'll give you a couple of tasks to perform, and I just want you to be able to you know just to check to see how you maneuver through the app, and we'll go from there. And any questions you want to ask while you're going through it, or anything that you want to say, just feel free to say it. Okay.
So yeah, actually, before we begin this, it came up as a web link. Am I meant to download something, or is it,
You can
is
you
it
can
came
just
up as a
simply
web
click
page?
on you can just simply click on it and open it.
So it came up as myhealthcare.gov as a web page.
I'm sorry.
So the app, so the link opened up as a web page.
Right.
It didn't open up as an app to download. Is that
No,
am
no,
I
no. That's
correct?
fine.
That's
That's fine.
it.
That's what it is. This is a prototype. So does it have the image
Okay.
in the front?
Okay, it has an image of a family on the
Right,
beach
right. So that
as
would be
well.
the landing, and that's fine. That would be the landing screen of the app. That would be the
Okay,
landing screen of the app. So I'm going to ask you to do a couple of tasks, and I just want you to know that this is clickable, so you won't be able to type in anything, but you will be able to click on
I
buttons.
see.
Okay. Okay.
Okay,
All right. So let's
okay,
start. First task that I want you to do is first sign in.
okay. So I would need to. So I would need to actually create an account first, yeah? Or
Uh,
just sign. I click on.
just sign in. Just
Okay,
sign
so
in.
I clicked on sign in. Okay, so it took me to a page. Say, take me to doctors or urgent care.
Okay. So this is what I want you to do. I want you to find a review for Dr. Jada Thompson. Dr. Jada Thompson.
Okay, so I click on doctors,
Okay.
find a doctor, put my zip code, um, specialization. So find Jada. Okay, so I see Jada Thompson. Okay, I click on Jada Thompson. It provides general Columbia Medical School practice methods. Okay, please refer to Dr. Thompson's ratings and reviews for further information. Okay, I see doctor. So I had to scroll down the screen, and perhaps it could just be my device. I had to scroll down the screen first to see doctor reviews and everything. So doctor reviews. So the first review came up. Dr. Thompson was helpful. She gave adequate medication for my heart condition. The second doctor was accommodating along with staff. I had a good repertoire with her. I plan on making Dr. Thompson my primary care physician. And then from Fabio said, I did not like service. I will not be back.
Okay. So that's good. Um, you found the doctor review. I have
Yeah.
another task for you.
Okay.
I want you to set an appointment for January 21st for Dr. Oli Candy.
Okay.
From where you are, set an appointment for Dr. Oli Candy.
Okay. So I
And
just clicked
and
on
tell
the
me what
home
you're
button.
doing. As
So
you
I clicked on the home button, assuming
okay.
that home would take me back to the options between
Okay.
doctors and urgent care. Then I clicked on doctors. Then I would probably put in my zip code, but instead I click find doctors and Dr. Oli Candy.
Mm-hmm.
I clicked on his name, scroll along the screen and click request appointment. And then I saw several options for the days as well as times. So I would click at you said 4:30.
Okay.
So and I clicked the appointment. So I have the appointment and it says your appointment submission has been received and confirmed.
Okay. Good. Um, Third task. This is what I want you to do. For the third task, just
Mm-hmm.
find an urgent care location. Just find an urgent care.
Okay. So I go back home, click on urgent care, put in a zip code and find urgent care. Okay, so it brought me up to several urgent care with the option to scroll some more.
Okay. So
And yeah.
okay. So make a rating for Riverton. Find a rating submission section for Riverton for the Riverton urgent care.
Okay, so I'll click on Riverton Urgent Care, see some information on this. I scroll down and find facility ratings. And it's about a 3 out of 5 for patient experience. Facility patient medical expectation, 3.4. Oh, they have a very strong rating for urgent care staff of 5 out of 5.
Okay.
And 58% of respondents will return for a second visit. That's pretty good. Yeah.
So far, how do you feel you're maneuvering through this app?
So it's definitely straightforward. I think there's no complicated task involved. It's a simple, 2 screens or so, two or three clicks away. I think that's really important because a lot of healthcare websites, you usually have to click 3 or 4 different links before you get to where you want to go, and but this one, it's like two, there's a home screen. It takes you back to the 2 most important options, which are doctors and urgent care. And it's again pretty straightforward. I can find the reviews, I can find the doctors, and it's all within 2 or 3 clicks on my thumb. So it's pretty usable. Instructions are the site doesn't need instructions, which is also important. I think sometimes these apps you have to kind of read a lot, but this is pretty straightforward.
Okay.
One thing I would add though is in the beginning of the first page, although we could assume that most people who have a device and phone and use an app probably have an email. Perhaps it might be, you might kind of think of a step first to get to the link. Well, one, email may or may not be a potential barrier for some people who may just want to sign in using like their name or something like that, or let's say a name, because the email assumes that you have to sign in and get an email confirmation stating that you're accepted on the site.
Right.
So perhaps given an option to include an email or other sign-in opportunity, such as your phone number or something like that, or any other needs. So I'm assuming that one, the email is serving as a function. Although I didn't see this option after I clicked my appointment, I'm assuming part of the reason why in the upfront you ask for the email is that when I make my appointment, I will get an email stating that the appointment is received.
Correct.
However, one additional option which might be helpful is to include, after the appointment has been made, to include a link directly. You can import the appointment directly into your calendar, into your phone calendar.
That's good feedback. That's good.
Yeah, because I think actually from today too, for instance, when you sent me this link, I imported it. So I clicked on the link, but I assumed there was a Skype since we originally spoke on Skype. But frequently now I'm relying more on, for example, like invites and things that I get from the school and any communication. Frequently there's a link that I can just click and it imports directly into my calendar because I'm so busy sometimes during the day. I'm trying to do more than one things, but if anything can make my life easier in terms of an automatic import with the dates, time, location of the appointment would be great.
That's really I didn't think about that. That's very helpful.
And actually, what would actually be even more easy, well, not more easier, but an additional option is, and this might be another business opportunity, which I'm seeing frequently done with Google and things like, it hasn't been done yet with Yelp. So this might be a unique opportunity for you to give the person opportunity to request an Uber in advance. So I was doing something, I forgot what I was doing today. And whatever appointment I made, actually, no, sorry, it was through Lyft. So whatever appointment, so I was making an appointment actually to go to the store, and I signed up on your account for Lyft. When I clicked on it, it said I could make an appointment in advance, which I never knew you could do with Lyft. I assumed you always had to request your ride as you need it. But it seems like Lyft has a new feature where you can request appointment in advance. So perhaps one way and one potential sort of side business model from this is that maybe there are people, and specifically even for urgent care requests, right? Who may or may not even have Lyft, or may not even know about Lyft, or may not even know about the full services of Lyft or Uber, that you can perhaps say reach out to those people and say, hey, this is an app I'm doing that is most likely going to be done on either an a planned basis or an emergency or informal basis. In either case, if it's a planned appointment, I'm going to link my system to your system to
Okay.
schedule a ride, right?
Mm-hmm.
The person can be billed. So let's say the person does not want to um, does not want to sign up separately for app,
Right.
for Lyft or Uber or whatever, you can kind of build that service. You can give the consumer option to link directly to cab service, whatever, right?
Mm-hmm. Oh,
Or for the emergency situation, you can say build in on the back end of your Lyft or Uber app an opportunity for a person to receive those third party
vendors.
transmissions. When that person clicks make my appointment for urgent care, because I'm assuming that urgent care
They
you want
can,
to go today or right now.
right.
So when that person clicks like urgent care, option comes up, should we book you a cab right away? If that person accepts the offer, then it takes them directly to Lyft or whatever to get it for a cab to come
Right.
to their house. And
That's
that way you connect some type of commission from that link or something like that directly to the person. But yeah, I think that's in today's service, truly service based economy, the more you can connect a consumer without having to figure out, well, damn, where am I going to get a cab now? Or how am I going to get to this location? Or do I have to use Google to look it up or figure out which bus I'm going to get there, whatever? Like you automatically give the user everything at their fingertips.
it's like all service basically.
Yeah, like a full service based industry. So you find the healthcare thing that you want to look up, you find the ratings, you book an appointment, it goes directly to your calendar. It also gives you an option to book an Uber for that date. If you book an emergency visit, it also gives you opportunity to request an Uber or Lyft right away to take you.
I'm taking these notes because this is important. And since you're the first one that I've out of the five that I'm looking at, those are things that I didn't think of, and that's really, really helpful. Thank you.
You know?
And it makes sense. It makes absolute sense.
Yeah.
Um, I do want you to I have a couple of more tasks, not that many.
Yeah, sure.
Reset your password because you forgot it. Tell me the path that you're doing, you know, what you were doing before.
Okay. So I would go back to. So I assume I clicked on the house, the home button. It didn't quite take me to the original page. So I'm assuming. So usually home usually means first page, but in this situation, home for you means the page where there's doctor or patient. So I'm assuming perhaps it could be another symbol for like facility, whatever, and home truly means the first page. So I had to actually click the arrow to the left to
Right.
take me back to the first page. So I would go
Okay.
to the first page and go below and click forgot password, and then it's easy. It took me to the option to reset my password.
Okay.
So that was pretty straightforward.
Okay. Um, Second task: find an accepted insurance plan for Ridge Park urgent care.
Okay. So I go back to home, click on urgent care, find urgent care. Um, clicked on Ridge Park. So well, it's so when I went to Ridge Park, I'm assuming that I would have been able to click on Ridge Park and see a different, but it said to read facility ratings and reviews, sign up. So So I somehow logged back out when I went back to the home screen. It didn't save my cookies and realize that I already had signed in.
Um.
So
Oh, okay, okay. I got what you're saying. I got what you're
yeah.
saying.
So when I click back, some websites they lock your cookies in. So even if you
Yeah.
click back, it
Right.
saves that when you go back to the page, you already signed in.
That's my fault. Actually, that's my fault. Sign in, because what we had was you were a guest before.
Okay.
You were a guest
Okay.
before, so that's my fault. Sign in and
Okay.
find an insurance plan for Ridge Park Urgent Care. That was my fault. So
Okay.
sign in.
So that worked. And then I clicked on accepted insurance plan, and this is perfect. I see all the insurance plans on here.
And so I'm going to ask you to do one last task. Okay.
Uh-huh.
Um, use the guest route and sign up.
Okay. And actually, all right. So one thing I see no checked. Why aren't you accepting any checks? Not that checks are bad, but it could be certified checks. And what about why only Master and Visa card only?
Well, that's just there's no specific reasoning for that. That was just me creating that.
Oh,
so,
because
so that's
that could
something
be
that
a
I could.
potential.
That's no,
Yeah,
that's fine. But that's good. That's good. That's something I never
that
thought of.
could be a potential deterrent. So usually what people would do is just put the symbols like cash, a credit card, Visa, Master. So the little dollar sign or cash, the Visa, what do you call it? The Visa or Mastercard logo, as well as perhaps some type of e-form payment like Apple Pay or whatever it is,
Okay.
uh, or Google Pay. Another thing too as well is your list of insurance plans is not comprehensive. So one option, perhaps so you've listed, of course, the top insurance plans that most people may have, right? But it might be helpful to include before no insurance plan something like your insurance not listed on here. You take a picture and give them the option, for instance, either to enter
Okay.
their enter their insurance plan to look up to see if it's accepted. So for instance, what if I use Harvard Pilgrim, right? Like
Mm.
I should, get a search option, like something that says, don't see your insurance here, click here to find out if you qualify. A person clicks the button and types in, let's say Harvard or whatever, and it populates the
The
field and you
number.
can click.
The number. The number to
But
the.
either the number or the name, however you want to program it, you could program it to the insurance number. But most likely it might be complicated because if in terms of programming, because I'm assuming different insurance companies like use different number systems, so that would be like really hard for a programmer, for instance.
But
So
see,
like some
but see,
insurance.
what you're saying is good. I don't want you to think about how difficult it would be to do something. I just want you to tell me
Okay.
what
So
you
yeah,
think
so
should
that's
be
a
done.
possibility. So either look up by name or by number. But usually insurance, you need kind of two pieces of information. You usually can't like put in the number alone. But either way, it's fine. Either you do that, or what I've seen now also is in several kind of online sites, when they give you an option to take a picture of your card, so you can like snap a picture of your of like, so for instance, like when I'm doing something, and I think actually Lyft does this. When you sign up for Lyft or Uber, one of these things, you could actually take a picture of your credit card and it'll upload it. So and like run the check for itself. So it does like a scan, whatever they do behind the scenes. So
Right.
assuming you can kind of give the person an option to take their picture of their insurance card.
Mm-hmm.
And actually that might be good in the future, because you truly want to at some point be able to go electronic, right? Like link this to electronic database, etc. So this would then give you opportunity to feed that information directly to the appointment system in place. So like, let's say if the person gets there and forgets the insurance card at home, right? Chances are the same system as delivering the appointment to the hospital to make for you, the
Mm-hmm.
same system that could transmit the information of the person's insurance card. So that way, if
Okay.
the person shows up in the office and like forgot their insurance card at home, they don't have to go back home, whatever. They already have a picture of their insurance card on file. So you can give, since especially since everything is being done on the phone now, you give the person an opportunity to have this stored in their profile or whatever it is.
Okay. All right. Good. Thanks for
Yeah,
that.
you're welcome.
Um, so I think for the most part, um, did you get a chance to sign up to? So you signed up and everything. You went through the sign up process.
Yeah.
Um, as you were working through this app, it's straightforward as you were saying. What
Hmm.
was how did you feel as you were going through it? What were your feelings about working through it? How did you feel? If someone were to ask you, how did you experience that app? What would you say?
Well, I think usability definitely is high, like 9 out of 10, if not a 10 out of 10. In terms of, I guess the simplicity, the home and everything, it's fine. The doctors, it's pretty good. What I would say is, again, maybe this is just a prototype and it's because it's generic. I think as always with apps, it's kind of having that um high end kind of like look in terms of whether it's like a logo or the
Right.
actual background. I mean, although this is fairly straightforward with the simple text
Visual design is
boxes.
what you mean. Visual design, yes.
Yeah. So the visual design, and also the family at the beach. African American family. It's not quite emblematic of healthcare, I guess. So I'm not sure. Again, if this is like a placeholder for
Hmm.
something else, but perhaps having like a true graphic design, I kind of come up with a logo for like create a original logo for what you envision this program or this app to be.
Right.
Right, and of course it could be myhealthcare.gov or whatever it is. I'm assuming that that's not your domain since it's a .gov anyway. But and actually, yeah. So that question, why is myhealthcare.gov on top there?
Well, that's the name I created because I'm pretty much looking at it from a standpoint of originally, this would have been in my creation a subset of the Obamacare, whereas this would be something that people could find as one of the links within the Affordable Care Act.
Okay, so well, two things. I would say one is that you probably won't be able to get a .gov, or you won't be able to associate yourself with a .gov, since it's they you know it's most of these things are independent. So
Right.
I would think that I would probably from the get go try to establish myself not as necessarily being a part of this thing, but
Right.
like your own entity. So I would kind of disassociate myself with it, especially with the new
With-
administration. This whole
Yeah.
thing may not even be. So
Right.
I would try to make this as independent as possible from my healthcare the government, and try to kind of create this as its own independent thing that links you. Because remember too, you're not dealing with people only with health insurance from you're dealing with people with private health insurance and people who probably don't even know about my healthcare.gov. So
Okay.
in general, we kind of interface much more generic in terms of like this your specific company is built on just making people's lives easier, right? So a kind of combination of find your healthcare, you know, a full service healthcare, sorry, a full service finder to
Mm-hmm.
healthcare um, um, streamline kind of thing, right? So you book your, and you can kind of market yourself something like that, like book your appointments, remember your appointments, get to your appointments on one place, something like
Okay.
that, right? So find your appointment online, you book it in your phone, we send a cab to pick you up, something like that, you know,
Right.
a kind of like full service or thing, right from the convenience of your phone
Mm-hmm.
kind of
Okay.
thing. So that the pictures, and of course, as mentioned, the visual aesthetics. But overall flow was pretty straightforward in my opinion. So
All right. Well, thank you very much. I really appreciate this feedback. And yeah, the whole point is to make whatever the user wants to find as easy as possible. The visual stuff comes after.
yeah,
Uh,
for sure, for sure.
the visual stuff comes after, and that's really helpful because it, it's the mindset is if you're using this, you're using it during an emergency situation. So you want to
Mhm,
just be able to get the information as soon as possible and have it
mhm.
effortless.
Okay.
So
Yeah.
I'll take your visual design um, opinions, and we'll work on that. But this has been really been helpful. I really appreciate it, Mr. Ransom.
And one last thing too, and I'm sure you probably aware. You're aware of ZocDoc, right?
I'm sorry.
Are you aware of ZocDoc?
I actually found out about ZocDoc about a week ago, a couple of weeks
So
ago.
yeah, I mean they're like web-based kind of thing, but there may be things you can kind of learn from that too, as you kind of use their web system, because that's also pretty straightforward. Which is, I think their model is that most insurance you kind of have to go through their directory to find people, but this kind of gives you a also open based platform to like find
Hmm.
people in and out of your network, book appointments, etc. So there might also be something to learn from that website as you translate your Star app. I'm not sure if ZocDoc has an app; they probably do by now. But of course, you're gonna have a niche and something that's of course different from them. So I think it will be good to kind of check out the competitors, if you will.
Okay.
See what that has to offer, like go through their system and see what kind of works. And also I think that might be helpful too, just for you to kind of see where, as you go through their system, like is there anything you wish you would cut out as a user for yourself, could
Hmm.
kind of make your app much more, as you say, effortless as possible. So but
All
this
right.
so far, this is a good start, to be honest.
All right. Well, thank you very much for that. I'll take your advice, and I'll let you know the results, the end product. Thanks again.
Okay.